Good day. My name is Michelle Lavander. Welcome to our webinar, What Happens When States Kick People Off Medicaid? I'm the founding director of the USC Center for Health Journalism. Thank you for joining us for this Health Matters webinar. As of this week, close to 4 million people have lost their Medicaid coverage as pandemic-era protections expired that kept states from bumping people off the health insurance program for low-income Americans. The abrupt loss of health insurance can have dire health consequences, especially for Black and Brown children and families who are bearing the brunt of these purges of the insurance rolls. Some states are disenrolling people at a breakneck rate. Many people who've been dropped from coverage are still eligible for Medicaid coverage, but they're caught in a bureaucratic nightmare of confusing forms, notices sent to wrong addresses, and other errors. Here to help us understand the implications of this chaotic situation and efforts on the ground to respond to this policy reversal, we have three distinguished panelists. Megan Messerly is a healthcare reporter for Politico, covering health politics and policy in the states. Before joining Politico, she covered politics and health policy for the Nevada Independent. She's also a 2023 National Fellow with the Center for Health Journalism. Keisa Smith is the executive director of the Arkansas Advocates for Children and Families. Previously, she served as deputy director for children and youth with the Arkansas Department of Human Services, where she oversaw the divisions overseeing child care and early childhood education, juvenile justice, and child welfare. And Jennifer Tolbert is director of state health reform and associate director with the program on Medicaid and the uninsured at KFF, formerly known as Kaiser Family Foundation. She also manages State Health Facts, a source for state-level data on over 800 health topics. This webinar is made possible thanks to the generous support of the National Institute for Healthcare Management Foundation, the Commonwealth Fund, the California Endowment, and individual supporters like you. You can tweet about this webinar with the hashtag Medicaid. We'll be archiving this conversation later today at centerforhealthjournalism.org. A word about our format today. We'll be hearing from our speakers first, and then we'll turn it over to our audience for your questions. Feel free to share general comments in the chat. Because we have many people joining us on Zoom, we'll ask you to write your questions for our speakers in the Q&A panel. You can also write us there if you're experiencing any technical problems. Now, let's get underway. Jennifer, KFF has a tracker that regularly updates the disenrollment numbers. Tell us what you're seeing across the country, who's being kicked off Medicaid, how many of them are actually eligible for coverage, and how easy or challenging is it for people to renew their insurance?
Thanks, Michelle. So I'll go ahead and kick things off and answer some of or all of your questions over the course of the presentation. Next slide, please. Just to kick things off and to kind of level set, I know you covered some of this in your introduction, but at the start of the pandemic, Congress included a provision in the Families First Coronavirus Response Act that required states to maintain Medicaid coverage for people on the program in exchange for enhanced federal funding. And originally, this continuous enrollment provision was tied to the COVID-19 public health emergency, but the Consolidated Appropriations Act, enacted at the end of December, delinked this provision from the public health emergency and ended continuous enrollment in Medicaid on March 31st. The CAA also phases down the enhanced federal funding available to states through the rest of the year. So what that means is states were permitted to resume disenrolling people from Medicaid or to start the process of unwinding the Medicaid continuous enrollment provision on April 1st. Though, as I'll discuss in a minute, states have different unwinding timeframes. Starting the process at different times. So states must also meet certain federal renewal requirements in order to continue accessing the enhanced federal funding. And they must also meet a new reporting requirements, which has proven very important for our ability to monitor the unwinding across states. Next slide, please. So I will just quickly note that because of the continuous enrollment provision, we've seen a fairly dramatic increase in the number of people enrolled in Medicaid. As of the end of March, over 93 million people were enrolled in the program, an increase of over 30% since the start of the pandemic. Now, we do expect that over the coming months, over the next year or so, millions of people will lose coverage. But leading up to the start of the unwinding period, a number of states took actions to promote continued coverage among those who remain eligible. So per requirements spelled out in the Consolidated Appropriations Act, all states have taken action to update enrollee contact information, either by doing direct outreach or pulling information from other programs such as SNAP and TANF. In addition, 49 states are taking 12 months to complete all renewals. So an important aspect of the unwinding is states have to complete renewals on every individual before they disenroll them. And CMS has allowed and encouraged states to take the full 12 months to process all of those renewals. And as I said, most states are. 2 states have decided to move a little more quickly and are processing renewals in 10 months. In addition, 49 states have at least one approved 1902 E14 waiver. That is a very technical term for flexibilities that CMS has made available to states to try and streamline the renewal process. So some of these waivers include allowing states to use information from other programs to complete a Medicaid renewal, or allowing people with zero income to self-attest to that, since it is somewhat difficult to confirm that information with existing data sources. In addition, a number of states are following up with enrollees before terminating coverage if they have not responded to renewal requests. And leading up to the unwinding period, 37 states took action to boost eligibility staff capacity. Next slide, please. So as I noted earlier, states began the unwinding period in different months. CMS required states to initiate the first batch of renewals in April, but states were permitted to start that process earlier so that they could begin disenrolling people in April following the required renewal period. So it's the other thing here is that the length of a state's renewal process does vary. So the federal minimum required notice period is 30 days. However, most states provide 45 to 90 days for enrollees to respond to the renewal request. So this map does show the month in which states were expected to be issued the first disenrollments for procedural reasons. And those are disenrollments where the state didn't determine that someone was ineligible, but nevertheless disenrolled the individual because they did not complete the renewal process. Next slide, please. So as I said earlier, the Consolidated Appropriations Act and CMS included new requirements for states to report data on renewal outcomes during the unwinding period. And as I said, this data has been critical to allowing us to monitor how the unwinding is unfolding across states. I will note that we have developed a tracker where we are pulling together state data on unwinding and disenrollments and compiling that across states that have made these data publicly available. I will note that CMS just released a set of data, their first set of data as required under the Consolidated Appropriations Act. The CMS data may differ from what we've reported on in our state tracker. It also lags by several months. So the data reported by CMS today include renewals through April. We are reporting renewals through June and even into July for some states in our tracker. But to date, in the 38 states and DC that have publicly reported data, over 3.8 million people have been disenrolled since April 1st. And overall, 38% of people with a completed renewal were disenrolled in these reporting states. So that means that 62% or 5.5 million people had their coverage renewed and remain on the program. Although it's not presented here, I will also note that disenrollment rates range across states and are fairly high in some states. So for example, the disenrollment rate in Texas is 82% and 76% in Idaho at one end of the spectrum, and 10% in Michigan at the other end. Next slide, please. So I think it's important to note that as we examine this disenrollment data, we have to keep in mind that we're still in the early months of the unwinding. And in fact, some of the data that we are reporting reflect only 1 month of data for states. So for example, the data reported in Texas is simply 1 month. In Arizona and Arkansas, we have 3 months of data, so we can begin to start to see trends. It's still too early across a number of states to identify any trends. But nevertheless, we're trying to figure out and make sense of the variation that we're seeing across states. And one factor that may be contributing to the differences is that some states are prioritizing renewals for individuals that they flagged as likely ineligible or who did not respond to renewal requests during the pandemic. And so while not all of these individuals, flagged individuals, will be determined ineligible or in fact no longer eligible, because the state has information to suggest that they may no longer be eligible, either because they experienced an increase in income or, for example, they aged out of children's coverage and no longer qualify as an adult. But because of this information, we expect the disenrollment rates among these flagged individuals to be higher than what we would see among enrollees who are not flagged. So again, that may partially explain some of the higher disenrollment rates we're seeing in some states, but it certainly does not explain all of the variation. There are many other policy and operational factors that are affecting these rates. Next slide, please. So perhaps more concerning, though, than the overall disenrollment rates are the high rate of procedural disenrollments in many states. So as I noted before, these procedural disenrollments occur not because the state has determined an individual ineligible, but because for a variety of reasons, the individual did not complete the renewal process. Perhaps they never received the renewal notice, or they were not able to submit the renewal form or required documentation within the state's timeframe. We're also hearing cases where people did submit the required documentation and forms, but the state workers were unable to process the information before an automatic system-generated termination notice was issued. So there are a lot of reasons for these procedural disenrollments. And overall, 73% of the disenrollments so far that we've seen were due to these procedural disenrollments. And so in response to the high procedural disenrollment, CMS recently announced additional flexibilities available to states to adopt that will hopefully reduce the paperwork burden and help people who are still eligible remain on the program. And some states have voluntarily taken action by extending deadlines by 30 days, adopting additional flexibilities through those waivers that I mentioned earlier to increase renewal rates, or in some cases, pausing procedural disenrollment rates altogether. Next slide, please. And so while a predominant goal will be to minimize the number of eligible people who lose coverage during the unwinding period, we also need to think about helping people who are determined ineligible transition to other coverage. An analysis of data from the medical expenditure panel survey that we did last year found that nearly 2/3 of people who disenrolled from Medicaid experienced a period of uninsurance in the months following that disenrollment. 17% became uninsured for the full year, while only 26% were able to transition to other coverage for the full year. And I will note, you can see from the data here that 41% of people ultimately re-enrolled in Medicaid within the year, and many of those after experiencing a month or more of being uninsured. And so to date, there's little data on whether people are obtaining other coverage when they're disenrolled from Medicaid, but this is an area to continue to watch. I will note that in the CMS data that released today, there is information on the number of people that have been transferred to the marketplace and have actually enrolled in a QHP. So I think it will be important to take a look at those data and to continue to press CMS and states for additional data. So with that, I will wrap it up.
Thank you so much, Jennifer. I want to follow up on something that seems to have come up in the CMS report today, that as many as 15 million may be disenrolled. Could you comment on that? And I understand that you have an estimate of, I think, 8 million to 24 million. I don't know if that's what you anticipate over the course of this kind of enrollment season, but those are really pretty staggering numbers.
Yes, so we had estimated, or we released updated estimates earlier this year of the number of people that we expect will be disenrolled. And assuming an overall disenrollment rate of 18%, we estimated that 17 million people would be disenrolled during the unwinding period. I will note, however, that as I said in my slides, the current disenrollment rate nationally based on reporting states is 38%. That is more than double the 18% that we used in our estimate. Now, I think that overall disenrollment rate will decline over time, and that's not where we will end up. But if we do end up there, we are looking at a much higher number, a much larger number of people disenrolled, more like 35 million and not 17 million.
That's a really staggering number. And so what percentage of the entire folks on the Medicaid rolls would that represent then? Is that the 38% then?
No, the 38% represents of all of the people so far who have had a completed renewal. And it's the 3.8 million plus 5.5. So we're talking about, 9 to 10 million people so far who've they're gone through the renewal process and have an outcome. The 38% is the share who were disenrolled. So that's different from, this overall estimate, and that's not the share of the total Medicaid population that has been disenrolled. As I mentioned earlier, at the end of March, there were 93 million people enrolled in Medicaid. So the 3.8 is still a pretty small share of that, but obviously that number will grow over time.
3.8 million. Yeah. Okay. Well, thank you for helping us understand the contours of all this. I'd like to take us down to a state level with a state that's been particularly aggressive in purging the Medicaid rolls. It's been part of a kind of public conversation. And Kisa, let's turn to you and talk about Arkansas. How many people have been disenrolled? What's happening in terms of notification and the process of being told about re-enrollment possibilities and so on? Give us a picture at a state level.
Yeah, so thank you, Michelle, and thank you for the opportunity to talk about what's happening in our state. So DHS, the Department of Human Services, has been issuing press releases every month since June, showing us how many individuals have been disenrolled each respective month. So as of July 1, and right now, as you can tell, since we're at the end of the month, we're waiting for July numbers. But as of July 1, there was about 200, give or take 219,000 individuals that had been disenrolled from Medicaid. And I know when we talk about other states' numbers, it seems like that's not so significant, but I would remind everyone that we are a relatively small state. We have a little bit over 3 million individuals that live here. We have a significantly high rate of poverty here with over 1 million individuals qualifying and enrolled in Medicaid. So when you have about 1 million individuals on Medicaid, to already have over 200,000 individuals disenrolled is a significant number. And Michelle, to your point about, how are they being notified? DHS has attempted to do, different forms of outreach. The traditional outreach is to get a letter in the mail stating that you need to fill out your renewal forms. One of the biggest drawbacks to that right now, though, is that Arkansas was a state that during the pandemic was still sending out documents to clients. And so individuals are confused. What they believe is that they received documents during the pandemic. They didn't have to fill them out, and they still were able to maintain their Medicaid. And now they are being removed from the rolls for failure to send in those forms. And so there is some confusion. Equally, the department has attempted to do other outreach mechanisms by phone calls, text, partnership with community organizations, which we're very appreciative of. We are an entity that DHS is talking to very regularly, and we are attempting to find individuals that have been disenrolled erroneously, because that happens, right? As you noted, Michelle, I've worked for the Department of Human Services. I work closely with our Medicaid team. And what I readily tell individuals is that state government is not necessarily nimble, and readily admit that there are flaws in the system. And when individuals are being disenrolled, the biggest concern for our advocacy organization is that there's not a fast track to get those individuals back on the rolls. And that could be particularly problematic as we approach the school year, but just problematic in the fact that many individuals may not find out that they don't have Medicaid until they're actually in the midst of a medical emergency and need it immediately, and will not have a fast track and ability to access it.
And Keith said there was an expectation that children on Medicaid would mostly remain eligible, but the latest data from KFF shows that more than a third of people who've been disenrolled in Arkansas are children. How did they end up being such a target?
So one of the things that DHS did, and they announced that the enrollments, they were going to disenroll by a series of categories. And one of the categories that they were starting with was our Kids A and our Kids B program, which are for children. So our Kids A is traditional Medicaid for children. Our Kids B is our expanded CHIP program. And so we did expect that the children numbers enrolling out would be high at the beginning, but not as high as they have been. And it is extremely, extremely concerning. The biggest concern for us is whether or not parents that have been disenrolled because they are no longer eligible know that their children may have a different form of eligibility that is available to them. And one of the things that we have talked with the department about, and that they are already doing, is they are cascading information about when individuals submit information to see if children are still available. But the concern is that we have, like many other states, a very high amount of procedural terminations, meaning terminations that are happening because individuals are not completing forms. And if that is happening, then there is no information to cascade, thus those children are being disenrolled. And so there has to be, even though, outreach has occurred, there has to be more targeted outreach, and there has to be individuals accessible on the agency level that folks can call quickly to get that information updated and submitted to the state, because we are concerned that, again, a large number of individuals are just not going to find out what has happened until it's time to get those, their children ready for school and get vaccines and, sports, their trips to the doctors to make sure that they're clear for that. And it's particularly concerning what's happening.
And Kisa, your organization is working closely with, many clients, and I'm guessing your phone lines might be pretty flooded with people who, as you say, are just kind of stumbling into this realization that they no longer are covered. Maybe you could give us a picture of what you're hearing from the folks that you serve and what kind of situations they've been finding themselves in, and also what it's been like for them to try and fix things.
Yeah, so, we're not a direct service entity, but we are an organization that many individuals have reached out to try to get additional information, because they've attempted to try to call their local county office and reach someone at the DHS office and have been unable to do so. That is information that we've given back to the agency as well, so that they can try to address that issue with the calls. But one of the things that I'm seeing, particularly when we're talking to the community, is just, as I noted before, a high level of confusion about the documents that they have received. And one of the particularly concerning things that we saw was in our Northwest area of the state, where we have a high Pacific Asian population, a high Marshallese population, where we were informed that the documents that DHS had translated into Marshallese did not actually make sense. Like, it didn't make any type of sense, because the words that DHS was using to inform Medicaid enrollment did not actually translate in a way that made sense. It actually came off as being very aggressive, and noting that if you read it, the one thing that they did that did translate was that these individuals had done something drastically wrong, which was concerning to individuals, and often led to individuals not completing the form for that reason, and for fear that there would be something punitive that happened to them. But what we are seeing, again, is just a high level of confusion from staff when they get documents that before they hadn't had to complete. And they're not able to call and reach individuals at the agency to ask questions and go through those forms. So people just don't know what are actually the ramifications of keeping those documents at their house.
And, this stuff about being enrolled, it might sound kind of simple, like you fill out the form, like people should know how to do that. But what we learned, for example, and Megan, your really in-depth reporting for Politico, was it's not that simple. There's a lot of ways that you could get tripped up that aren't intuitive. And you really chronicled people confronting some very harrowing situations in Arkansas. And I'm wondering if you could walk us through a few of the folks who were some of the characters in your reporting.
Definitely. Yeah. Happy to do that. Yeah, I think when we think of, the renewal process, you look at these forms, and, during my reporting, I sat down with folks and went through them with them. And I had a hard time trying to figure out what they mean. And I'm someone who spends at least some portion of my brain consistently thinking about Medicaid. And, it was hard for me to figure out, what they needed to do to retain their coverage. So one of the women I spoke with, actually two of them, lost coverage because they had not moved forward with the child support enforcement process So essentially, what that meant was in one of the cases, the woman had no idea that she wasn't cooperating with child support enforcement. She actually was trying to make just a doctor's appointment. She was having these really bad headaches that were keeping her up at night. She was getting no sleep. And so, she went to go make a doctor's appointment, as many of us might. They told her, sorry, you don't have Medicaid. And she was, shocked. She, was completely unaware that she had lost her Medicaid, was confused as to why. She's unemployed, so she makes no income. She's a mom. I mean, there's a lot of things that would make her eligible for Medicaid. And so when she dug into it a little bit deeper, she found out that she had lost coverage because she hadn't cooperated with the child support enforcement process. And so this is as a condition of receiving Medicaid, folks are required to, participate in this process. And
interrupt you there. When you say not cooperate, if I'm understanding it right from having read your story, what that really means is her partner or former partner wasn't paying child support, and she hadn't kind of filled out some form from some completely different agency, so
Yes.
they could garnish this wages, not something that she would have intuitively associated with her health benefits. Is that right?
That's correct. Yeah. And so when they use the term did not cooperate, it doesn't have to be like a proactive non-cooperation. It can be passive, you didn't know that this is something that you had to do in order to receive Medicaid benefits. In her case, she was like, what does this have anything to do with my Medicaid? It seems like a totally separate issue. But it's not. And I'll say in another case, I was talking to another mom who actually had the same issue, lost her coverage and was skipping a long list of medications while she was trying to get her coverage straightened out. But she told me she had gotten a letter in the mail from child support enforcement back during the pandemic. She called a few people. They said, you don't need to worry about that. So she didn't. Fast forward to today, she loses her Medicaid coverage because of this, non-cooperation. She told me, she was like, I don't want to go through this process. My child's father, my ex-husband and I have an arrangement. I'm fearful of what could happen, if I were to cooperate with this process. And so in Arkansas, there is a way, they have this form, and you are able to actually request an exemption because it would cause some sort of, physical, emotional harm. You can get an exemption from moving forward in that process. But it took her calls to the state, to her local Medicaid office, to the child support enforcement office, and then back between those two to get someone to tell her that there was a form that she could fill out to get this coverage reinstated. And I actually just heard from her a couple of weeks ago. She was able to get her coverage back in place, which is great. But I mean, she skipped her medications for, the better part of at least 4 weeks, maybe 6 weeks. She was off, a lot of things for rheumatoid arthritis and lupus, and she has a bunch of chronic conditions that she's managing. And so, something like child support, you would think doesn't have anything to do with Medicaid, but it does. I talked to someone else who's on a very technical part of Medicaid, and there was all this paperwork she needed to do, and she kept going back and forth with the state about whether or not she had completed it. And so there's just a lot of very granular details that make it really hard to get through this process, even if you have the best of intentions and are really trying to complete the paperwork and keep your Medicaid.
And thank you. That's really helpful, Megan. You delved into Arkansas in particular, and I'm wondering why you chose that state, and maybe just share a little also about your reporting process and how you found the folks like those whose stories you're describing right now.
Yeah. So, I started looking at Arkansas because they passed this law in 2021, the legislature did, that said, anyone who, had not had an eligibility determination during the pandemic, that means they didn't, again, you didn't have to return your renewal paperwork. A fraction of people did, but anyone who did not, and there had not been a determination of their eligibility, those folks would have to have their coverage redetermined in a period of 6 months. And so that was a very compressed time frame. They're working through this very quickly. And so earlier this year, I had written a story, looking at Arkansas, some of the potential problems they might face as a result of this compressed time frame. And I should say, Arkansas was really approaching this from a perspective of fiscal responsibility, especially thinking about Medicaid managed care, right, where the state is paying this like capitated rate to insurance companies to provide coverage to folks. So they were saying, for those folks, like we're just paying a flat fee to these insurance companies and just basically, putting money out the door for folks who may no longer be eligible for Medicaid. And so for lawmakers, they really saw this as like a fiscal issue. And so they said, as soon as the pandemic ends, we want to get through this as fast as possible. And I think talking to people broadly, there's an agreement that, of course, people who, are no longer eligible for Medicaid, they're on employer-sponsored insurance, they have other coverage, like, of course, they don't need to be on Medicaid. But the problem is, how do you get those folks off without the other folks falling through the cracks? And so part of the challenge of a compressed time frame is it just means like more room for errors, right? Like overworked staff are struggling to answer calls. It just makes everything harder the shorter amount of time that you squeeze it into. So that's why I was interested in Arkansas specifically. So I had done a story earlier this year. And then I did a story in June, really looking at how unwinding was going so far in Arkansas. They were one of the earlier states to begin coverage termination. So both because of that and because of this compressed timeframe, they sort of serve as like a canary in the coal mine of how things are going. And I mean, now that we're at end of July, like basically every state is now in the thick of this. But Arkansas was sort of on the early end of this. And again, because of that 6-month process, they will complete that process earlier than a lot of other states will, as they're doing this, well into next year. So I think they offer sort of an interesting case study. And I'll talk about how I found people in a second, but I just wanted to add, like, looking at the data now, there are so many states that are running into the problems that Arkansas is, right? Like you look at the numbers and Arkansas has this very high procedural disenrollment rate, which means, again, folks losing coverage because of paperwork issues, because they didn't send things back in, et cetera. But a lot of other states do too, and they have rates that are higher than Arkansas's. And, in some ways it's hard to compare because every state has their own plan. They're, tackling different populations in different orders. But I would say based on what, I'm seeing now and what we're seeing in the data, Arkansas, I think, was like an early indicator of a lot of the things that we're seeing now, which is what made them interesting to focus on early in the process. So like I said, I had, been in touch with a lot of folks earlier this year in Arkansas, built some relationships. And so when I was doing this story, I actually had been going back and forth with legal aid of Arkansas. I was talking to them before about their concerns. And then, as they actually started sending out termination letters, I was checking in with them like every week, 2 weeks, just asking like, what are you seeing? What kind of calls are you getting? And so I think it was like maybe a month in, like early May, they had finally, because it takes some time for people to realize they don't have coverage if they've lost coverage, and that was not their goal. And so I think by early May, they were really starting to see that. And so I was, talking with them about what they were doing, and they had mentioned they were doing these clinics. They were going out into communities and meeting with folks. They do a bunch of different things like record sealing, helping people with their Medicaid paperwork is just one of them, but they mentioned they were going to be going out and doing this. And so I said, would you mind if I tagged along to see, what folks are saying? So a lot of the folks I spoke with, I met at that clinic I went to. So folks who were going to talk to legal aid about their issues. Other people I found, Facebook is a great resource. Like there's a lot of groups, support groups for people. So I found actually a lot of people through Facebook as well who were just posting about some of the challenges they were having with Medicaid. Actually went directly to the Arkansas Department of Human Services website where they would post things about Medicaid unwinding, and people would respond to the comments about the issues they were having. And so I just reached out to a lot of them to hear what was going on, what their stories were. And then there are also just some like specific like Facebook support groups that I just was like reading through, and I just messaged a bunch of people. And obviously not everyone wants to share their story with you. I mean, talking about healthcare is a very complicated topic. Not a lot of people may want to share that they're on Medicaid. But I was very fortunate that I found quite a few folks who were, willing to talk me through what they were going through in this process.
And the other thing is, and thank you, this is really helpful. As we know, this is an area, Medicaid in general, but it's kind of health policy, it's just chock full of jargon that, the famous way that we judge if a story is accessible, like, can your grandmother understand this sentence kind of thing. And we even had a debate here internally as we titled this webinar, like, let's not use unwinding, this kind of a technical term in the title of our webinar. And then there's all these other words, redetermination, procedural disenrollment. So what's your advice for journalists on how they can be precise, but also make these topics accessible for a general audience?
Definitely. I can say it's not easy. I feel like I developed like a stock phrase I started using, like, as states began to, or as pandemic era protections for Medicaid enrollment and things like that, to sort of explain why what's happening is happening. But it's hard. It's like an inherently very complicated topic. And so I think for me, I think about it two ways. So one is when I'm talking to people about what's going on, I usually just say like, hey, what's going on with your healthcare? Like they don't, Medicaid, whatever terms, like sometimes people don't even know they're on Medicaid necessarily. Like talking to people in Arkansas, people who are on, it's not actually managed care, but they have this private option, but it's basically like Medicaid managed care in some ways. But their Medicaid is through a private insurance company. And so a lot of them don't even realize they're on Medicaid, but they get letters from the Department of Human Services. So they know the state's somehow involved. So I always just start off asking people like, what's going on with your healthcare? Like that's kind of what we care about, right? Like what barriers are there to you accessing the care that you need? And then I'd say when it actually gets to writing it, I think I just try to explain it in the simplest of terms. So, a term that comes up a lot, like that we've already been talking about, is procedural terminations, procedural disenrollments. It can mean a lot, it can mean a lot of different things. But I like to think about it at sort of its simplest term as like paperwork problems and bureaucratic red tape kind of issues, right? Like Jen said, these are people who the state was not able to, they didn't have all the paperwork and they weren't able to look at it and say, okay, yes, you are eligible, or no, you're not eligible, right? They're in this other group where the state did not have all the information it needed to make a determination. And that could be for a number of different reasons. Like at the very basic end, people, their address was wrong. The letter went to the wrong address. The person never knew that the state was trying to get any information from them. They didn't respond. They lost their coverage that way, right? It could mean like some of the people I spoke with for my story, they had been actively going back and forth. They were calling their local DHS office. They weren't helpful. They were calling other people for help. Like they're trying to work through the process. Maybe they'd submitted some documents, but not all of them. But they did not complete that process by the deadline, and they lost their coverage. The one thing I will say, a lot of states, I think have and will continue to push back on the idea that procedural terminations are bad. And I mean, they are. So what I will say is that a lot of states will say, people who were procedurally terminated, you can't say they were all accidental, right? Because these are people who just didn't respond. We don't actually know like what happened to them. So sometimes they will say that, people who have employer-sponsored insurance, right? They have another form of healthcare. They will get that letter in the mail, say, oh, Medicaid. Oh, I'm no longer eligible for that. Like, I'm just going to throw it away. And so those people don't go through the process of, submitting all the paperwork and, what have you, only to be told that they're not eligible. They already know they're not eligible. So a lot of states, I think, will say, remember, like that makes up a portion of procedural disenrollments, which I'm sure it does, but we don't know, right? We don't know how many people are in that. Yes, I made a conscious decision to ignore this notice because I know I'm not eligible. So I am technically a procedural disenrollment, but I'm making a conscious choice about it, versus the people who either didn't know or were struggling to get through that red tape process. So that's the one thing I will say, because we will get pushback from states being like, you can't talk about procedural terminations like they're all horrible. So it's important, I think, to sort of recognize like who falls under that banner of procedural terminations. And so I think that just comes back to just explaining with plain words about what you're trying to say, right? Where these people who didn't turn their paperwork back in, they didn't know, they were going back and forth with the state. I think just like being as specific as you can be about what you're talking about, or if you do use a term like procedural disenrollment, just explain, what you mean by it.
So we have a lot of questions here. I'm going to turn to them and we'll see how many we could get through. We have about 20 questions right now, or some of them are just more comments. But if you do have a question, I encourage you to put it in the Q&A and we'll try to get to as many as we can. We have a question from Esther Dyson. I'm curious about whether Walmart is helping at all in Arkansas. It would be a good way for generating goodwill and helping their customer base. And by the way, I have to say that Kisa, who's deeply knowledgeable as both a former insider and heading a nonprofit, has lost her internet connection. So we're trying to get her back in, but I don't know if that's something, Megan, you would have even touched upon in your reporting research.
I have not heard about that specifically. I mean, what I can say is that, there are states that have tried to get creative with outreach. I haven't heard about anyone specifically reaching out to Walmart, but, states I think have been trying to leverage like all the access points to Medicaid recipients that they can, or as many as they can. So in a lot of cases, that's reaching out to Medicaid managed care organizations, which again are these private insurance companies that provide Medicaid coverage. That's an option. Some states are reaching out directly to providers, like providing them lists of people who haven't responded or are up for renewal or things like that. So there are sort of various like strategies that states are adopting to try to reach people other ways. If they've sent letters and they've texted and what have you, they're trying to reach them through other access points. But I can't speak specifically to whether anything is happening with Walmart or not.
So I'll just mention, we have a lot of very technical questions about individual states. I'm going to try to read out some of the more general ones first, and then if there's time, we could go to that. We have a question from Vinuri Sirawardani saying, can the panelists talk about the connection between Medicaid eligibility and SNAP eligibility and how higher Medicaid disenrollment rates could affect food insecurity rates? Is there a connection there?
Well, I will note that some states and CMS, as one of their flexibilities, allows states to align Medicaid redeterminations with SNAP redeterminations and to share information across programs. Now, the eligibility requirements don't line up exactly. So, if someone is renewed for SNAP, for example, you can't assume that the person will also be eligible for Medicaid, but there can be a sharing of information. I don't think that, obviously if someone is disenrolled from Medicaid, they're then not necessarily going to be disenrolled from SNAP unless, again, their situation has changed and the SNAP redetermination ends up determining the person to be ineligible as well. So I think the goal of the sharing of information is actually to facilitate keeping people on both programs and not kicking people off. But to the extent that people are losing Medicaid coverage and perhaps then losing connection to this social safety net, it is possible that we could see higher rates of food insecurity if people are also losing their SNAP benefits.
So we have a question here that says, did KFF do any separate analyses of Medicaid expansion states? For instance, did adults go back to work, access marketplace exchanges, fail to renew due to procedural reasons?
We have not looked separately at expansion versus non-expansion states. And again, the disenrollment rates that we're seeing are a little bit all over the place and don't track by expansion versus non-expansion status. There are like competing factors here, right? The income eligibility in expansion states is a little bit higher. So you might expect more parents and expansion adults to remain on Medicaid because that income limit is higher. In non-expansion states where people may have been kept on the program, but a slight change in income would make them no longer eligible because of the low eligibility levels for parents in some states. So I think this can cut both ways. It's worth looking into. We haven't done that yet, though.
And do you mind, Jennifer, to just explain to folks who are a little new to all this, just the difference between an expansion state and a non-expansion state and what that would mean in this context?
Sure. So under the Affordable Care Act, it provided states, initially required states, but then because of a Supreme Court decision it made it optional whether states would expand Medicaid. But this Medicaid expansion
Medicaid
allows states
to what? Just so people, yeah.
Yeah, allows states to expand eligibility to all adults up with incomes up to 138% of the federal poverty. And so prior to the Medicaid expansion, there were most childless adults or adults without dependent children were not eligible for Medicaid, and that remains the case in states that have not adopted the expansion, with the exception of Wisconsin, which is in a slightly unique situation. But also in non-expansion states, the eligibility levels for parents are much lower. The median eligibility is about 30, I think about 40%, roughly, give or take, again, compared to 138% of the federal poverty level in expansion states. So a lot more low-income adults are covered in expansion states compared to non-expansion states.
Thank you so much. And Kisa, we're so glad you're back. And I know you're on your cell phone, so thank you for heroically rejoining us. We did have a question for you from somebody named Sinead Hunt, who says, why did Arkansas begin the redetermination process with children? And that she'd heard that some states had prioritized individuals who they presume are no longer eligible for coverage. This is rather technical, such as those with ESI. If most children are expected to be continually eligible for the program, then why not wait to initiate the redetermination process to allow community partners more time to conduct outreach? And in reply to this, I would ask you just to define all the terminology along the way, because I mean, I don't know what ESI means, and I'm guessing a lot of other people here don't either.
Yeah, and so I will try to tackle those pieces. So I think one to context set, in 2021, the Arkansas legislature passed a bill that stated that once the public health emergency ended, Arkansas had to begin to immediately evaluate any case that had not been evaluated in the past 12 months, and that the redetermination pertaining to those cases had to be done in 6 months. And so the reality is that this process is going to be fast no matter what. And so I think that the goal for DHS was to try to do as much outreach as possible, but equally to try to address that population early, so that if in fact there were problems or individuals were disenrolled for erroneous reasons, that would happen with enough time to try to correct that in advance of school beginning. I don't want to speak out of turn for the exact discussion, but the reality is that no matter what, the populations are being moved through quickly anyhow. And I am not particularly familiar with the term that the individual was using. So if they could maybe provide some more clarity, that would help.
Okay, yeah, thank you. And I wanted to return to a question that somebody asked that I alluded to at the beginning, but I think it's important to emphasize and hear from all of you. Lionel Ramos asks, are certain demographics as far as income, race, ethnicity, sex, gender being unenrolled at disproportionate rates? And so, I think all of you probably have a reply to that. Maybe we'll start with Jennifer on the data end, and then, turn to you, Kisa, and Megan on what you were seeing on the ground too.
Yeah, so this is an area where there is very limited data across states. States are not required to report demographic information on around the renewal outcomes. Now, a handful of states are including this information on their dashboards. New York, for example, also Washington, Arizona has some data. But it really is at this point, we have very little information as to whether people of color or other groups, people with disabilities, for example, are being disenrolled at a higher rate than others. And I think this is an area where, we should continue to press states for additional data. Many states have these data and just have not chosen to make the information public. So unfortunately, not really any good information at this point.
And what, I don't know, Kisa, from your experience of knowing both from being in the government before and now in the nonprofit sector, what has been your experience of, who are the folks who are on the, receiving Medicaid now in a state like Arkansas, and what you might know about how they're being impacted by all this?
And Michelle, I'm sorry, I'm still having technical difficulties. Repeat that one more time for me.
Sure. So Jennifer just said that there's not a lot of data that we have, official data, about whether certain groups by race and ethnicity and so on, gender, are being disproportionately affected by this. And so what's your sense of that from your unique perspectives?
Well, I mean, I think the reality is that this is the Medicaid population, right? So by virtue, it's going to be a marginalized population because it is going to be low income individuals. And so those individuals are going to have, resource limitations in other ways that are not just financial. Many areas of our state where we have high Medicaid enrollment are also areas of the state that don't have broadband access. So these individuals are going to be, doubly hampered by the fact that, they can't, that they can't easily, access the internet to use that enrollment process. They're trying to call equally if they have limited transportation. All of those things are going to hinder you from being able to very quickly try to re-enroll into Medicaid. And so I think that's just a natural group of individual, like the population that is on Medicaid tend to be individuals that are in marginalized communities to begin with.
And we have a question. Thank you, Kisa. And actually, Megan, did you want to add anything on that question at all?
I think they did a good job of summarizing it. The one thing I would say is also thinking about some specific populations that may have challenges, and states are doing, for instance, sometimes extra outreach to cancer patients or dialysis patients. But I was also talking to a behavioral health provider who was telling me, they work with a lot of patients with psychosis who are, very worried about the government sort of being after them generally and have a lot of government mistrust. And so she was saying, you get a letter in the mail from the government saying you need to do something, you already, are experiencing a mental health issue that leads you to not want to trust the government. It's extra hard for that person to complete the process. And so they were worrying about a lot of their patients being able to get through that renewal process and working with them to do so. Again, I think whenever we think about any, unhoused population where they don't have stable housing, there's not an address where you can consistently reach them. When I was in Arkansas, I visited with a center that's sort of a hub for a lot of unhoused folks, and people can get their mail delivered there. And I was talking to the head of that center, and he was telling me he doesn't open them because you can't open someone else's mail, but he's seeing these renewal letters come through for people he hasn't seen in months, right? So I think about some of those specific challenges those populations, may have to completing the renewal process.
We also have a few really technical questions, but I think they're important to ask as we capture the scale of this in individual states. But do you all have a little time to go? We're officially at a close, but can we go another maybe 10 minutes just to get through a couple of those? So one is from Brittany Howell. She says, since April, the Centers for Medicare and Medicaid have halted Medicaid eligibility checks in 12 states to address issues causing procedural disenrollments, but the agency hasn't announced which ones. Does anyone know what states that number includes?
I will say no, that we don't. And I think this is partially purposeful on CMS's part. They've been very reluctant to call out states by name. I mean, and there's a lot of bigger conversation happening around this in Congress, right? About like what CMS is doing to take action as lots of folks are losing coverage. But CMS has really retained this posture of they're trying to work collaboratively with states to fix all these issues. I mean, it's not going to be just unwinding. These are states they need relationships with moving forward. Medicaid as a program is a state federal partnership. And so they've been really trying to not sort of take the extreme steps and to publicly call out a state or, say that you've ordered a state to stop disenrollments or recommended they stop procedural terminations. Like that in of itself, CMS releasing that information like would be perceived as a pretty significant step to actually like publicly sort of name and shame states. And, it's worth noting folks in Congress, have been frustrated that CMS isn't doing more. They can impose financial penalties and things like that. There are things CMS can do, but those would be like pretty dramatic steps. And CMS hasn't been willing to go there yet. But I think we have seen in terms of just the way they've been talking about it, there is like more urgency in the way they speak about it. But they have not said specifically which states those are.
That's really helpful. And we have a really technical question. And Jennifer, maybe because you look like you were saying to say, I'll just toss this one out there too. And then you could, or do you want, actually, why don't you go ahead and say what you were going to say on this one so I don't muddy things up too much.
Yeah, no, I was just going to add to what Megan had said, which is, I think, right, this is purposeful on the part of CMS. We are aware of Oklahoma, for example, has currently paused procedural terminations voluntarily, and they've made that public. Idaho had previously done similarly paused procedural terminations for April. A handful of other states have extended the essentially the deadline by 30 days for people to respond to renewal notices, which effectively means they are pausing procedural terminations at least for another 30 days. So those states are Minnesota, New Jersey, Kansas, Michigan, and there is one other state, and I apologize, I can't remember exactly which one it is, but at least those are a handful of states that we know of.
So Brittany Howell, back again with another precise question here. Does the Centers for Medicare and Medicaid have guidelines and requirements about how to report re-enrollments? I've been told by a few sources that our state is counting re-enrollments as new enrollments. And then we had another kind of technical question from Whitney Downard. My state, Indiana, said in their report that 1/3 of their procedurally disenrolled population had a non-procedural reason, such as their income is too high, or they moved, or a death. Is that not a procedural reason? So it's just these kind of trying to understand the data.
Sure. Well, I'll chime in on the Indiana issue about the procedural disenrollments. We are now starting to see some states providing information to kind of inform these procedural disenrollments. So yes, all of those people that the state reported as having a procedural disenrollment were disenrolled for paperwork reasons because they didn't complete the process. But Indiana, Georgia as well, provided additional information to say, well, among these individuals, we have information for 10,000 of them, of these people who are procedurally disenrolled, that indicates that they are no longer eligible, either because they're over income, they moved out of state, or there are other reasons. But the state was unable to confirm that information, so had to categorize the individual as a procedural disenrollment and not as having been determined ineligible. But that's, an example of the kind of information then can help inform some of, what we're talking about and some of these procedural disenrollments. Again, some of those people are probably still eligible, so we don't know that, but it is additional information that is helpful. And then on the other question, I'm sorry, it just.
Oh yeah, it's does the Centers for Medicare and Medicaid have guidelines and requirements around how to report re-enrollments? I've been told by a few sources that our state is counting re-enrollments as new enrollments.
Right. So there is a 90-day reconsideration period when someone is disenrolled from Medicaid, especially if they're disenrolled for a procedural reason. They have 90 days to submit the information to the state, and they should have their coverage reinstated without having to go through and submit a new application. And that new application process can take a lot longer. So the reinstatement of coverage should happen much more quickly. I think there is a question about how states are, reporting those individuals. Are they, some states are actually tracking those individuals and noting the folks that are coming back onto the program within that 90-day period. Other states are not. And so I think it is somewhat unclear how states are recording those individuals, whether they're being reinstated or whether they're being counted as a new applicant. Sounds like CMS is working. We know CMS is working with states across all states to try and streamline and standardize the data reporting. So I'm pretty sure that's an area they're working on, but I don't know that for sure. And I don't yet know how states are recording that information.
I'm just going to add one thing to that too, which is that I know both from talking to people, from talking to people, they've told me that sometimes they've either like talked to some kind of organization or gotten advice from someone, or in many cases, they've just done this themselves, but they don't know about that 90-day reconsideration window. And so they are just going ahead and applying, right? So I think it is also worth keeping an eye on states, application numbers and new enrollment numbers, right? Because there are going to be some people in that group that are people who maybe should have been re-enrolled, but instead they get back into Medicaid through that other avenue.
And I'm guessing that, Megan, you sort of answered this question by talking about folks who are particularly vulnerable to being disenrolled, but James Alexander asks, do you see a disproportionate amount of people on waiver services like intellectual disability, brain injury waivers who are disenrolled? I'm guessing we don't know, but that would be a logical assumption, right?
Yeah, I mean, Jen, you can tell me if you've seen any data on this, but I don't think I've seen anyone break things down that specifically. I do know, and this I think is something worth doing, like every state has their own unwinding plan. You can read through it, they'll tell you like what order they're doing things in, are they doing special outreach? And so I know some states, have said they're either, tackling certain waiver populations toward the end of the process, to give them sort of the maximum amount of time to make sure that they keep those folks covered. Or doing like extra outreach and things like that. But, other than just, I think anecdotal reports from folks, I don't think we have a great sense of, exactly how that's going up, or if there are disproportionate impacts, or if states are doing extra outreach to those folks, is that working? I don't know that yet.
Jennifer,
and I was just going to, I'm sorry, Michelle, I was just going to add to Megan's point, and states like for Arkansas, when the enrollment numbers have been, or disenrollment numbers have been coming out, they have been coming out by category. So the particular category that individuals with disabilities would be in has not been released yet, but we would be able to see that type of information. To the point that Megan was making, every state is not the same, but states that are reporting like Arkansas we would be able to see that data.
thank you. That is so helpful. And a question from John Nayoko Nayasani to Jennifer. I don't see any data for Wisconsin. Is that because they haven't reported any disenrollments or some other reasons? And similarly for other states, Jennifer, are there some states that we just don't know at all about?
Yeah, so there's a handful of states that really aren't beginning disenrollments, or at least procedural disenrollments, until July. And so the way that typically works is these will be people whose renewal was due in July. And so the termination will actually happen kind of on August 1st. And the reporting of those disenrollments or renewals is likely to happen in August. So we are anticipating that for the handful of states that, well, not handful, slightly more than a handful of states that we don't yet have any data on, including Wisconsin, Illinois, and some other states that are starting those disenrollments in July. We're hoping that we'll get data for those states in early August, but it remains to be seen. And at this point, again, while CMS is releasing data that states are reporting to them and states are required to report these data, the CMS data lag by several months. So we are still at this point very reliant on states choosing to make these data public and voluntarily posting the data on their websites where we can then access and add to our tracker. But we will add, and we are adding data daily as states are making the information available.
So I just have one more question, and I'll start with Megan, but ask others if they want to chime in with other perspectives. But Republicans and Democrats often have very different perspectives on Medicaid. And as you are covering this, can you walk us through the politics and what differences reporters might want to note or understand in covering this issue in a red state versus a blue state? I know this is a big question and we're sort of toward the end of our time, but it does seem valuable to kind of highlight some of this for folks.
Definitely. Yeah. So, I mean, I think going into it, obviously, red states and blue states are going to have different thoughts about what Medicaid is, what it should be, who it should cover, how many people it should cover. Those are some pretty big differences. I mean, like on one end, we've seen Democratic controlled states move in the direction of covering undocumented folks. The federal dollars can't be used to pay for those people, but they have created basically Medicaid, state-funded Medicaid for folks like that. So on one side of the spectrum, you have efforts to expand Medicaid to cover as much people as possible. And then on the other hand, you have, red states like Arkansas that are pushing to do work requirements again, to sort of restrict the pool of people who are eligible for Medicaid or put certain conditions on their Medicaid eligibility. So I think thinking about that, the overall framework of Medicaid and folks' thoughts towards Medicaid is important. And then in specifically thinking about unwinding, I would go back to what I mentioned with Arkansas. You talk to lawmakers there and they're not, they don't want to kick people off who aren't eligible, but they are very concerned about, state dollars, about fiscal responsibility, and so, they'll talk about, we need to get through this process as fast as possible. Because we need to save money, and we do, obviously want to protect people, but we can't be spending all this money on people who aren't eligible for Medicaid. And then I think you talk to folks in Democratic controlled states and it's the other side of the coin, right? Where it's like, okay, we really are concerned about people falling through the cracks, but also that's going to cost a lot of money, right? States are they got extra money from the federal government to keep people enrolled all this time. That money is titrating down. So the longer states take, right, the more sort of slow and methodical they are, they're also going to be increasingly on the hook for paying for that. And so there's these two tensions between, how much a state is paying and, how quickly they move through the process and what that means as far as people falling through the cracks. So I think in a lot of Republican controlled states, I think you'll, hear a lot of messaging about, making sure that people who are eligible for Medicaid, who are the most vulnerable, that they stay on Medicaid while also being fiscally responsible. I think you'll hear some, but slightly less talk about sort of the fiscal responsibility side in, Democratic controlled states. But I think, thinking at a very core level about sort of folks' motivations and what's sort of driving their policy making is really helpful in sort of understanding the policy decisions they're making. And I would just add as well that, again, we talked a lot about Arkansas, Texas has, disenrolled 500,000 people. So you see a lot of, red states with things, not going well. But especially in this, tranche of data we're going to get hopefully at the beginning of August, we're going to get a lot of blue states. Like a lot of blue states started this process later. So we're going to have a sense of okay, which strategy is working, is neither working, are people falling through the cracks in both states, right? And I think the thing with this to think about is it's a problem of how much you do, right? Which strategies do you adopt, right? If you take no action, you implement no new strategies, like X number of people are going to fall through the cracks. And maybe for every step you take, you prevent slightly fewer people and slightly fewer people from falling through the cracks, because you're trying to put together this like patchwork of strategies to make the process better and to prevent people from slipping through those cracks. And so it's a question of like, what actions have states done proactively to prevent this? And you can go online, you can see, what waivers states have applied for and what things they've done. And I would encourage everyone to go look to see like, oh, my state's done this, but not this. They, could have done this, but they chose not to do it. But I think it's really a question of, like how proactive states are about really taking efforts to keep people from falling through the cracks, even if they are really of the mind that, this is a question of fiscal responsibility and really making sure that the state is using its dollars wisely.
Thank you. And Kisa, before we close, any thoughts on this coming from a red state where you were both high level in government and now at a nonprofit?
Yeah, no, I think Megan did a great job giving, a very comprehensive answer about, really the differences that she's seeing. I think the reality is that even back in 2021, with the law that I referenced that made it so that Arkansas had to do the reevaluations within 6 months, was a larger bill that really looked at, and it's the specific intent of the bill was to address fraud and waste in governmental programs. And we see a lot of that and a lot of discussion about whether or not individuals that are not eligible, do not deserve to be on social programs, are remaining on programs. And so as the unwinding was occurring, it was definitely a discussion about the fact that the Medicaid rolls had grown significantly, over 200,000 additional individuals during the pandemic. And all of the discussion was around ensuring that the individuals that were actually eligible and in need of services received those, as opposed to individuals that were still on the rolls as a result of the pandemic. And so we do see, a very hyper focus on ensuring that individuals that are deemed to be no longer eligible or in the adverse, individuals who have failed to comply with the requirements to remain eligible are no longer on the rolls. But as Megan noted, if you talk to legislators and individuals in the administration here, I could not imagine that there was one single individual that would not react very quickly to an individual that was eligible being disenrolled and wanting to get that issue rectified. The issue is that when you do have larger numbers of individuals that are still eligible being disenrolled, then we have to have a quick action plan for how we get those individuals back on the rolls.
Well, with that, I'm going to thank our really insightful speakers, Jennifer, Kisa, and Megan, and to the audience for all your great questions. I would also like to thank the team working behind the scenes to produce this webinar, content editor Ryan White, communication strategist Apurva Mandar-Bishu, and program specialist Andrew Perez, as well as contributing editor Fran Smith. We'll be sending all of you a survey asking for your feedback on today's program and also for your ideas on future topics of interest. Please take a moment to complete it. We'll be archiving this webinar a little later today at centerforhealthjournalism.org. Thank you so much for joining us and have a wonderful day.